Hi, welcome to Professional Certifications channel. Let's break down RHI exam preparation, one topic a day for focused and effective learning. Today's topic is ICD-10 PCS, International Classification of Diseases, 10th Revision, Procedure Coding System.
1. What is ICD-10 PCS? So, what exactly is ICD-10 PCS? ICD-10 PCS stands for the International Classification of Diseases, 10th Revision, Procedure Coding System. It is a coding system used in the United States to classify and code inpatient hospital procedures. While ICD-10 CM is used to document diagnoses, ICD-10 PCS is specifically for procedures, such as surgeries and treatments performed in a hospital setting. ICD-10 PCS was developed by the Centers for Medicare and Medicaid Services, CMS, and replaced the ICD-9 CM procedure codes in 2015. The goal of ICD-10 PCS is to provide a more detailed and comprehensive system for documenting procedures, improving accuracy, and supporting healthcare billing and reimbursement.
2. Structure of ICD-10 PCS codes. ICD-10 PCS codes are different from ICD-10 CM codes in their structure and format. Each ICD-10 PCS code is made up of 7 characters, and each character represents a specific piece of information about the procedure. Let's break down how the structure of an ICD-10 PCS code works. 1. First character, section. The first character indicates the general section or type of procedure. For example, 0 represents medical and surgical procedures, while other characters represent sections like imaging, administration, and obstetrics. 2. Second character, body system. The second character refers to the body system or region where the procedure is performed, such as 1 for the central nervous system or D for the respiratory system. 3. Third character, root operation. The third character identifies the root operation, which describes the objective of the procedure. Root operations include actions such as excision, removal, insertion, or transplantation. 4. Fourth character, body part. The fourth character specifies the exact body part where the procedure is performed. For example, if the procedure is a heart valve replacement, this character will indicate which heart valve was replaced. 5. Fifth character, approach. The fifth character indicates the approach used to perform the procedure, such as open, percutaneous, or endoscopic. This describes how the surgeon accessed the body part during the procedure. 6. Sixth character, device. The sixth character indicates whether a device was used in the procedure. For example, if a pacemaker was inserted during the procedure, this character would indicate the type of device used. 7. Seventh character, qualifier. The seventh and final character serves as a qualifier that provides additional information about the procedure. It may specify if the procedure was performed with certain techniques or if there were special circumstances.
3. Importance of ICD-10 PCS in healthcare. ICD-10 PCS plays a critical role in healthcare, particularly in hospital settings, where accurate documentation of procedures is essential. Let's explore why ICD-10 PCS is so important. 1. Precision and procedure documentation. ICD-10 PCS allows for highly detailed and precise documentation of medical procedures, capturing specifics like the body part, approach, and device used. This level of detail ensures that healthcare providers have a complete understanding of the procedure performed, which improves continuity of care. 2. Facilitating billing and reimbursement. Hospitals rely on ICD-10 PCS codes for billing and reimbursement from insurance companies and government programs like Medicare. Properly coding procedures ensures that hospitals are accurately reimbursed for the services they provide, and it helps reduce claim denials due to coding errors. 3. Supporting quality improvement. Because ICD-10 PCS provides specific information about procedures, hospitals can use this data to analyze outcomes and identify areas for improvement. This helps healthcare organizations track the effectiveness of different treatments and surgical techniques. 4. Enhancing research and reporting. ICD-10 PCS codes provide valuable data for medical research and public health reporting. Researchers can use this data to analyze trends in healthcare procedures, track the use of certain surgical techniques, and evaluate outcomes across different populations. 5. Ensuring compliance with healthcare regulations. ICD-10 PCS helps hospitals comply with regulations by ensuring that all procedures are properly coded and documented. Compliance with coding standards is essential for meeting federal and state requirements and avoiding penalties.
4. Root operations in ICD-10 PCS. One of the most critical elements of ICD-10 PCS coding is the root operation, which describes the primary intent or objective of the procedure. There are 31 root operations, and each one corresponds to a specific type of medical or surgical action. Let's go over some common root operations. 1. Excision. Excision refers to the cutting out or removal of a portion of a body part. An example would be the removal of a portion of the liver, such as during a liver biopsy. 2. Resection. Resection refers to the cutting out or removal of all of a body part, such as the complete removal of the colon during a total colectomy. 3. Insertion. Insertion involves placing a device into a body part. A common example would be inserting a pacemaker into the heart to regulate heartbeat. 4. Transplantation. Transplantation refers to the replacement of a body part with a living or synthetic substitute, such as a kidney transplant. 5. Drainage. Drainage refers to the removal of fluids or gases from a body part. An example would be the insertion of a chest tube to drain fluid from the lungs. 6. Bypass. Bypass involves altering the route of a body part, such as creating a new pathway for blood flow around a blocked artery during coronary artery bypass surgery. 7. Repair. Repair refers to restoring a body part to its normal structure or function, such as suturing a laceration or repairing a hernia.
5. How to use ICD-10 PCS codes effectively. Using ICD-10 PCS codes accurately requires a solid understanding of the code structure and the specific medical procedure being documented. Let's go over some best practices for using ICD-10 PCS codes effectively. 1. Start with the root operation. The first step in ICD-10 PCS coding is determining the root operation, which is the most critical element of the procedure. This describes the primary objective of the procedure, such as excision, insertion, or transplantation. 2. Verify the body system and body part. Next, identify the body system and body part involved in the procedure. Make sure to select the most specific option available to accurately reflect the location of the surgery or treatment. 3. Select the approach. Choose the correct approach that describes how the procedure was performed. This could be an open approach, where the surgeon makes a large incision, or a percutaneous approach, where a small puncture or incision is made to insert instruments. 4. Include devices and qualifiers. If a device was used during the procedure, make sure to select the appropriate device code. Additionally, include any necessary qualifiers to provide further detail about the procedure, such as specifying the type of graft or prosthesis used. 5. Follow ICD-10 PCS coding guidelines. ICD-10 PCS has specific coding guidelines that provide rules and conventions for different types of procedures. It's important to stay up to date on these guidelines and ensure that codes are assigned according to official standards.
6. Best practices for ICD-10 PCS compliance. Ensuring compliance with ICD-10 PCS coding standards is crucial for accurate documentation, billing, and reimbursement. Here are some best practices for maintaining ICD-10 PCS compliance. 1. Regular staff training. Provide ongoing training for coding staff and healthcare providers to ensure that they understand how to correctly use ICD-10 PCS codes. Regular education helps maintain accuracy and keeps coders up to date on new procedures and coding changes. 2. Use coding software and tools. Leverage coding software and decision support tools to simplify the coding process. These tools can help coders quickly find the correct codes, verify body parts and procedures, and reduce the risk of errors. 3. Conduct coding audits. Regular audits of coding practices can help identify potential errors or areas for improvement. Auditing also ensures that coding practices comply with regulations and that hospitals receive proper reimbursement for the procedures they perform. 4. Collaborate with clinical teams. Work closely with clinical teams to ensure that procedures are documented accurately and in enough detail to support proper coding. Coders and clinical staff should communicate regularly to resolve any ambiguities in procedure descriptions. 5. Stay current with updates. ICD-10 PCS codes are updated regularly to reflect advances in medical procedures and technologies. It's important to stay informed about these updates and incorporate them into your coding practices.
Conclusion. In conclusion, ICD-10 PCS is a vital system for documenting hospital procedures, ensuring accurate billing, and supporting patient care. Understanding how to use ICD-10 PCS codes effectively is essential for medical coders, health information management professionals, and healthcare providers.